Hey guys, welcome. This is Marcy, and I'm going to talk to you a little bit about the trauma brain and how we can biohack our brain to feel better and not react to all the trauma that we've dealt with in the past or we've encountered in the past. Because, a lot of times in life, we go through trauma and it's just part of life. And sometimes people go through their whole life and not experience any type of trauma. But other times people go through event after event. And that affects their whole success in life, relationships, and even finances. The biggest thing is we have to learn how to calm the trauma brain and what we can do to be effective in moving forward for the future. This was all part of my biohacking when it comes to the brain. And I'm going to tell you a little bit about how we can do that with the biohacking our mind and our body and our brain, and how we can maybe change our post-traumatic stress that we experience from trauma from the past. Because post-traumatic stress can be like nightmares, flashbacks, panic attacks, super anxiety. You could be preoccupied with the event that happened. It could be experiencing the trauma all over, especially if you start thinking it in your head over and over again. When a person experiences something very traumatic, their adrenaline and other neurochemicals actually rush into the brain, and it actually puts a picture in your brain. And that memory is actually what triggers us later on. It hits the emotional side of the brain and it starts disconnecting from part of the brain that conducts reasoning and cognitive processing. The reasonable part of the brain is unable to help the emotionally overload from the event. The brain goes into trauma. Statistically, it's estimated that 100 people who have experienced trauma, 25% or 1 in 4 will experience PTSD. That could be anywhere from, you could have had a car accident or a loss of a loved one or a loss of a job. So it all depends on how you react, and our bodies are all different. We have 3 different parts of our brain, and that is our forebrain, which is our prefrontal cortex, and that's a lot of our emotional part of our brain, and it's also reasoning, and limbic system, which is in the middle, and that is, a lot of our movement. And then we have the brain stem, which is responsible for our breathing and our heartbeat and everything that we don't control. When a person has a traumatic event, the adrenaline rushes through the body, and it puts like a picture into the amygdala, which is part of the limbic system. And the amygdala holds the emotional part of the event, which includes intensity and how much emotion was actually put into that event. But say if you're like at a roller coaster or something really exciting, like an exciting event, your sensory actually is processing excitement, not life-threatening. The amygdala then can read the emotion behind fun and exciting. The amygdala actually stores the images of the excitement in there. The same thing happens with the trauma. If you're going through an exciting event that creates a cortisol, like if you're running, being chased by armed robber, or if your house is on fire, that, triggers the negative part of your emotions, and it gets stuck in your amygdala, and it's almost like a file. You have a file in your head, and it is, way back there, because then you want to just put it to the wayside and not think about it. But then it may be triggered. It could be triggered through different visual images or sounds or smells, or even somebody just talking about something that triggers it. The biggest thing is we have to learn how to calm the trauma brain. We may not be able to cure it. If you're having any suicidal thoughts or any type of horrific emotional distress, I would definitely recommend going to see a professional psychiatrist or psychologist or your medical professional. I am just giving you some suggestions and some modalities that may help you process your healing from your trauma. But just make sure if you're having any effect ask that you definitely go and talk to somebody. Talking through an event is very, very helpful as long as you're not being triggered and the person that you're talking to, you're in a safe environment and you can engage with whoever you are talking with. So I would definitely recommend talking to somebody if you've had some traumatic events in your life. Sometimes it's really difficult to calm that part of our brain when we are in the midst of it. And the biggest goal is we have to bring a lot when we start going through the stress and we're triggered. We have to bring oxygen and blood flow back to the brain so we can calm the body. And that is by doing different modalities to activate our vagus nerve. And our vagus nerve is what helps us with calming. So we can do some deep breathing, which is very good. Diaphragmatic breathing, that's very, very helpful. We can also do different therapies. You can do, which is music therapy, meditation, red light therapy, prayer. But, there's all kinds of different modalities that we could implement if it's something you're looking for. But I do offer that. I do offer meditation classes and relaxation classes. And so if you want to get onto my website, Holistic Lifestyle Now, I'd be more than happy to get you into one of the meditation classes online, or we can do a one-on-one and get you feeling a little bit more calm. There's also pressure points that you can work with to calm the body as well. And sometimes it's not as easy as it sounds, but it is doable. With that said, I'm doing this to help you because I've had some traumatic experiences in my life, and I know what it's like to go through trauma, and the best way to overcome it is do the best you can with what you can at that very moment, and I would be more than happy to help you with that. So again, holisticlifestylenow.com, and I'm looking forward to hearing from you. Talk to you soon. Bye-bye.